Hi, my name is Dr. Al Freedman. I'm a practicing psychologist, and I specialize in supporting the psychological needs of rare disease patients and families across the United States and around the world. I'm also a dad. My son, Jack, was diagnosed with spinal muscular atrophy almost 30 years ago. And at the time, he was 6 months old and given 1 year to live. Thankfully, my son lived for 26 years. And in the 26 years of taking care of him, I learned a great deal about what it's like to live with a rare disease and the needs of rare disease patients and families. So, as a practicing psychologist, I now specialize in supporting other families like mine who face these challenges. And I support the mental health needs of patients and families by providing counseling services, individual counseling services, support group facilitation, and I also advise rare disease advocacy organizations and industry partners in rare disease on how to support the mental health needs of rare disease communities. At the World Orphan Drug Congress in Boston, I did a presentation on how industry partners can support the mental health needs of rare disease communities. First, I think it's important for everyone to understand the foundational principles I work with have to do with the common experiences that rare disease patients and family members have. First is the experience of the trauma of the diagnosis. We have the life before our rare disease diagnosis and the life we have after are two different worlds, essentially. And it's a very life changing experience to find ourselves with a situation we didn't expect, which is often very life threatening. Second, once we get our feet under us after adjusting to this life changing news, we live with lots of uncertainty. The patients and families I serve are all, regardless of the rare disease, the country, the culture, what they all have in common, what we all have in common is needing to navigate life with uncertainty. And uncertainty comes with anxiety when you don't know what the future will hold. When you're living with a lot of uncertainty and you're offered a diagnosis that can be life threatening, it's hard to have hope. So, hope is a scarce commodity. Where do people find hope when they're traumatized by a life threatening medical diagnosis and a lot of uncertainty? Most people that I know, and myself included, in rare disease, we find our strength in community, a community of people who've been where we are, strengthen and support each other, strengthen and support us, and give us hope where the medical appointments we have often focus on what we won't be able to do, what won't be possible, the things we won't be able to do, and the parts of our body that won't be able to function. There's not a lot of focus on what is possible. And others who walk the path that we're walking on or in a wheelchair on, they know what is possible and help us to focus on possibility rather than impossibility. I've learned that along with a rare disease comes some unusual rare gifts too. The gift of perspective, the gift of resilience, the gift of creativity. Rare disease patients often can't do things the way everybody else does them. I couldn't with my son for 26 years. So meeting the needs of rare patients requires a lot of rare creativity. And we find ourselves, families find ourselves searching for people who are willing to adapt to our unusual needs and to help us live our lives and adapt. Mental health is important too. And another lesson I've learned along the way is that although we have to focus on being alive in some cases and taking care of our medical needs, we have to pay attention to our mental health as well, because it's a very stressful experience, very, very stressful. So a light has been shined on mental health because of the pandemic. And I think that's been useful and has destigmatized mental health. In the presentation, I talked about scientific progress, as this was a conference for industry partners. And the scientific progress has brought new hope to many rare disease communities, including my own. A child with my son's condition, spinal muscular atrophy, is now screened at birth in the United States, and there are 3 approved treatments. So there's been a miraculous transformation over the 30 years I've been involved. And a baby like mine, who's born now in the United States, is treated early and is often walking and not having a short lifespan in a wheelchair with a ventilator and a feeding tube, as my son did. So there's a lot of hope with scientific progress, and there are also a lot of challenges. with scientific progress, a lot of unanticipated ethical challenges, access to treatment. The funding is difficult, access to treatment, the ethical challenges, and I'm often brought in to consult with industry partners about their managed access programs and about clinical trials in order to help there be a sense of fairness for the community about who has the benefit of the treatment and access to the treatment, because not everybody can benefit at the same time. And that's very stressful. And it becomes a mental health issue individually for a patient and family, and also collectively for community. When industry partners partner with rare disease communities, my central message is this is a mutually beneficial investment. Sometimes industry partners hurry through that relationship building and don't get to know the communities as well as they could. But the industry partners that do well with rare disease communities take the time to ask the rare disease community leadership and families, what do you need? So I advise them, ask, what do you need? What does your community need? To listen to what the patients say, and then to respond creatively to meet those needs. Listening goes a long way. And I find in my work as a mental health practitioner that I sometimes don't say very much, but the patients feel so supported when they feel heard and listened to. So I encourage industry partners to take the time to really listen to what the patients say. And by doing that, you earn the trust of the rare disease community. And it takes a long time to earn the trust of a rare disease community, but it takes a short time to lose that trust. And because there are differing priorities, a business, a pharmaceutical company, a biotech's goals are not necessarily the same thing as the patient community's goals. The industry partners' goals are often to get the stock price up and to sell their company to make a lot of money, where the rare disease community's goal is to serve the patients and to support the well-being of the patient community. So we're looking for the intersection between those two sets of priorities. Industry partners support the mental health needs of the communities, first by earning their trust and listening, and second by sponsoring programs that help connect people, bring people together, and help the communities to support the mental health needs of their constituents by sponsoring live events and conferences, by sponsoring live interactive focused workshops I'm often asked to facilitate, by sponsoring live support groups, ongoing support groups once a month where the families can be together, the patients can talk with each other about this unusual experience. It's an extraordinary thing when I log on to a Zoom, an industry-sponsored Zoom for a rare disease community, and I'll find 12 or 15 people who are in 10 different countries who have a rare disease that nobody else has ever heard of. And they're so hungry for connection with each other. And they keep coming back every month to check on each other and to support each other and to offer each other knowledge of doctors, knowledge of their experience, and just to vent, to explore options, and to compare notes. They become a second family for each other. These programs are very powerful, along with one-on-one peer support programs, often industry sponsored, where experienced patients will mentor a newly diagnosed patient. When you bring people together, it strengthens their mental health. And when industry partners take the time to get to know the communities and to meet their needs by bringing the communities together and supporting them so they have that connection with each other and can strengthen each other, it goes a long way. And you don't need a PhD psychologist involved to make that happen. I'm involved directly in some of these programs, but many I'm indirectly involved in coaching the communities on how to use the sponsorship donations to make the biggest impact on the community. Every community is different. And finally, rare disease patient advocacy group leaders have a unique set of needs because they're often running an organization and taking care of a family member or a child at the same time. The dual set of stressors. So oftentimes I'm called on to offer support for the staff or the leadership of a rare disease advocacy organization. Sometimes I'm called in as a consultant to do case consultation for patient advocacy groups or industry partners who are trying to help an individual family or have a situation that's complicated for them, and they need a mental health practitioner to help them figure out a way to approach a complicated situation. Sometimes I'm called in to support the rare industry partners themselves, because if they're doing their jobs well, an industry partner is getting to know the community and then can feel the same feelings that the community members do. If industry partners are doing their jobs well, they're getting to know the patients and families. Sadly, sometimes there are losses in the community. The death of a community member has a great impact on a community and sometimes on the industry partner that gets to know them. Industry partners want to engage with rare disease communities, and sometimes they don't know how, and they need help with sort of etiquette training. How do we go to this conference for the first time and interact with the rare disease community in a way that will feel supportive? And sometimes I offer consultation to the leadership teams, the advocacy or marketing people within the rare disease industry organizations to advise them on how to stick together, how to meet the needs of the communities, and how to interact with the communities in a productive way. And finally, lastly, I'll say within big companies, people behind the scenes don't often get to meet patients. They sometimes are very energized by being reminded of the importance of the work they do. So sometimes I'm brought in to say, thank you for doing what you do. You're making a big impact on the families you serve, and here's why. And as a family member myself, I explain the impact that their efforts make on the quality of life for the patients they serve. And oftentimes it's the person in the back office or the maintenance person or the administrative assistant or the person who's doing billing or insurance or some other business function who doesn't have face-to-face contact with patients, who are just so grateful to be connected to the purpose of what they do. So my work has taken me around the world to situations and people and rare disease communities and industry partners that I never would have expected. And my son Jack is kind of always on my shoulder wherever I go, keeping me honest and helping me to, in an authentic way, support the needs of everybody involved in such important work. We're all in this together, and none of the patients and families can do this by themselves. We need all the help we can get as patients and family members. The doctors need help, they're under stress, and the industry partners are under pressure too. So when everyone's working together for a shared purpose and are connected to the purpose of what they do in a meaningful way, it goes a long way to supporting the physical and mental health of the rare disease communities and the people who serve them.